Welcome to On Call, Paging the Frontlines of the Future, a podcast powered by Project Unity. I'm Hargun Sachar, your host, and a proud member of Project Unity, a student-led initiative transforming how we talk about healthcare. At Project Unity, we believe meaningful health innovation begins by listening, not just to professionals, but to young people living and leading within today's health systems. This podcast brings youth into dialogue with experts across medicine, public health, and digital health to explore real stories, pressing challenges, and bold ideas, reshaping health equity in schools, clinics, and communities. Whether you're a student leader, an educator, or a healthcare professional, you're in the right place. This is where emerging voices and experienced minds come together to reimagine the future of health. Join us for a powerful conversation with Rotimi Kukoyi, Truman and Morehead-Cain Scholar, Senior Class President at UNC Chapel Hill, and Director of PHIC at Project Unity. With experience launching UNC's first free STI testing initiative, shaping Medicaid policy in North Carolina, and advancing primary care in Nigeria, Rotimi leads the Youth Public Health Innovation Coalition at Project Unity in empowering young changemakers to rewrite public health equity. In this episode, Rotimi shares his journey from Jeopardy champion to policy innovator, exploring how youth can drive real systems change through advocacy, innovation, and coalition building. Hi, Roti. Thank you for joining us today. Where are you joining us from?
Hey, Morgan, thanks for having me. Today I'm joining you from Boston, Massachusetts.
Awesome. That sounds amazing. Thank you for sharing. So let's dive a little bit into your personal journey. What experiences in your early life sparked your passion for health and education equity?
Yeah, thanks for the question. I'll say I've always been interested in science and problem solving. When I was in middle school, I thought I was going to grow up and become a mechanical engineer or a programmer. And I realized that while I loved problem solving, I also loved people. I felt that within those roles, within those fields, they were a bit more removed from people than I wanted to be. But I still really love that analytical thinking and that creative aspect of those fields. So freshman year of high school, when I took a biology class, I really loved it because for the first time, I started to see how science could be applied directly to humans. We're thinking about things at the cellular level, at the organismal level, at the ecological level, and I started to see a lot of applications for science to the real world. And I started thinking about medicine a little bit, got into the lab, got to chat with some doctors, and really reaffirmed my passion. Then, after the pandemic hit, my sophomore year of high school, I learned more about the field of public health, and I saw that public health and medicine are deeply interwoven. They had been treated as silos, I think, a bit more in the past, and that's still an issue that people are starting to try and overcome. But I think post-pandemic, we've seen a lot more integration between public health systems and healthcare delivery systems. And so that's the space I realized I wanted to operate in. Now, regarding some more of my specific interests, I would say, like being in high school, there were a lot of different inequities I saw in the classroom and in the pandemic. And so that made me start thinking about how could I operate at that intersection and do something with my career to make an impact on it. But yeah, I'd say that's what really led me in my early life, at least to begin the journey that I've continued to pursue so far in college.
Thank you so much for sharing. And we can see how recognizing those disparities led you to take action and create change. So, how did your research on the ACT score gap in Alabama shape your understanding of systematic disparities?
Yeah, that was my first informal introduction to sociology.
Mhm.
And the high school I went to, so it wasn't a class that was offered. It's not something that you really learned. You got bits and pieces in history, but not really. And so for my AP capstone program, which kind of serves as a newer alternative to IB diploma offered by the advanced placement courses at College Board, I got to do independent research on the topic of my choosing, and I chose the Black-White ACT score gap after learning a little bit more about just educational inequities the prior year and wanting to explore, what does this look like in my home state with publicly available data sets? And in doing that process, it was very eye-opening. I think a lot of times I was seeing in my day-to-day life educational inequities. I went to the largest high school in Alabama. I believe my school was 27% Black, which equated to maybe 700 Black students total. And, I was the only I was the only Black male in all seven of my AP classes senior year out of hundreds of kids. And so obviously, something's not right there. And nobody really points that out. Nobody really testifies it. And I think in a way you internalize that when you are a kid, you don't really have that knowledge. And so, when I was reading research, from people like Sean Reardon at Stanford or Raj Shetty at Harvard and really looking at how these historical and sociological systems impacted outcomes for minorities. It was very educating, it was very disheartening, it was very empowering, it was very inspiring. I saw spelled out in front of me with statistics and very rigorous evaluation to back up the fact that the centuries of discrimination that Black Americans had gone through in America and the propelling of those systems through practices like redlining, the dependence of school systems on local taxes, property taxes, had
Mhm.
created a system where public schools and lower income inner city environments were getting less funding, they're not able to get the teachers they wanted, that they needed for their students. And so you're starting to see these educational inequities that would go on to then impact all other aspects of life. I mean, economic inequality is deepened by educational inequality. Health inequalities are deepened by educational inequalities. That research, just for the first time in my life, I realized that there are structural factors, very large structural and historical factors impacting individual outcomes far more than individuals' behavior and choices. And I think that's a narrative that sometimes gets missed in public health. I think sometimes physicians and public health practice, well, actually, no. I think public health practitioners are pretty good at systems thinking. But I think the traditional way that medicine has been taught to people and storylines have been told is that when you have a person who is sick, they are sick because of the choices that they had made in that alone. And that's not the case. That's what I learned. I learned that, you know, individual behavior does account for some success, specifically within health. The HHS estimates that 20% of your health is determined by behavioral determinants, but then you have that other 80%, right, where it's social determinants of health, and then you have what is the other 30%? I'm forgetting what the other percent is.
Oh,
But yeah, you just have these factors socially that determine a lot of individual outcomes. And so yeah, that's how that project affected me.
thank you for sharing. That was super insightful. And it's super evident that this is something that resonates with you and you care deeply on this topic. And that's amazing that you were able to look into the disparities and vocalize your need for change. So, can you share how your time with the Student Health Action Coalition influenced your perspective on community health needs?
Yeah, so the Student Health Action Coalition, or SHAC as we call it, is the oldest and longest running student-run clinic in the United States. It is operated out of UNC Chapel Hill.
Mhm.
It's a great organization on Wednesday nights primarily, but some other nights as well. We have free clinics for children, adults. We do dental visits. There's psychiatry services.
Mhm.
There's social needs services. There's pharmaceutical services. It's a very comprehensive set of primary care services for under-resourced members of the community who might not have insurance or the ability to see your typical primary care doctor. And so, yeah, that's the organization I've been involved with. Obviously, UNC, and I really love it. Specifically, I serve as the co-director of Vet Covered Carolina, and we are a branch of SHAP that helps patients navigate insurance and medical debt. So patients will come in for the most part because they are uninsured and can't afford to. So I'm going to silence my phone really quick because it's vibrating a lot. They can't afford to go to a primary care doctor, but we don't want our services to be what they're limited to because it's just Wednesday evenings. And, we provide good safety net care, but it's not optimal care. People deserve to be treated long term by more than just active medical students. So we really help people try and transition to a long time primary care physician by helping to screen them for Medicaid, or financial assistance from UNC and other local hospitals and
Mhm.
other alternatives just to make sure that they're able to escalate their care if needed so they can see a specialist if they need. They can go to the ER if they need without having to worry about crippling medical debt.
Well, thank you. We were able to learn a little bit more about your personal journey and what fueled your passion to start your advocacy in public health. So now we'll move on to a little bit more about systems. You've operated at the nexus of health policy, education, and community advocacy. So, what challenges have you observed in aligning educational systems with health equity goals?
Yeah, I think a lot of times we're thinking about public health. People see these fields as siloed. It's something I touched on a little bit earlier. But most people, when they think about school, they're not thinking about health. Most people, when they think about health and hospitals, they're not thinking about school. But those two are deeply interconnected. It's my belief that the school system and the healthcare system are probably the only two regular touch points that people really have in their lives. And after that, you're kind of doing your own thing. And so I think we've seen sometimes that students are coming to school, for example, and they're not being fed lunch. You have the free school lunch program actually ended in some states. And that means that kids are going to school and they're coming back home hungry. Well, if you don't have proper nutrition, you're going to have worse health. Maybe you can't control the onset of your diabetes, or something, right? And so we can't look at these two systems like they're not related because they are. And so a lot of the work I've done has been in trying to bridge these two systems to help push towards healthier people overall. So, for example, one project I worked on my freshman year of college was interdisciplinary projects with the North Carolina Division of Health and Human Services and the North Carolina Division of Public Instruction. So the systems that deal with health and school. And specifically, I was evaluating grants that went to public schools
Mhm.
across North Carolina with the goal of spending on services to improve behavioral and mental health for students and employee well-being. So specifically, I was interviewing counselors, principals, analyzing budget data to see what schools were purchasing and spending money on in order to improve the health for their students. That was a
Mhm.
super cool project because it taught me a lot. For example, a lot of schools today now have these professional counselors embedded
Right.
within the school system. And that's something that, wasn't really a focus when I was in elementary school. So I think there is some progress because schools are recognizing there's this huge unmet behavioral health burden in students and it's increasing. And we need professionals to come in and step in. And schools are a great way to reach students and provide that service for free. Another thing I'm doing right now on the flip side is working with primary care community health centers across the state of North Carolina to get FAFSA application materials within those clinics. Because again, you have so many people, particularly low income marginalized people, are going to these FQHCs and they're going for healthcare, but they would benefit additionally from being connected to education because education is great for individual health and population health and economic mobility. And so just thinking about where we have traditionally seen silos, how can we get these stakeholders together in ways that are mutually beneficial is really one of the driving questions that is always in the back of my mind when I'm operating in any new space.
Mhm. That's awesome. Thank you for sharing how you intertwined education systems with your health equity goals. And how did your internship with the Clinton Health Access Initiative in Nigeria inform your approach to global health challenges?
Yeah, so last summer I spent 10 weeks in Abuja, Nigeria with the Clinton
Mhm.
Health Access Initiative, and
Mhm.
it was really transformational. I had never done anything in the global health space.
Mhm.
I think two things it taught me. The first one I would say is all interventions are context dependent. What I mean is that you have to tailor it to the community that you're in. Specifically, I think a lot of times in the past, and global health is evolving because even I was hesitant to step into this global health field. I'm not the biggest fan of global health because of
Mhm.
just that colonial history, When you think about the origins, you think about these white people and the Western hemisphere of the world going to lower resource nations and telling them, this is exactly, we know your situation better than you. This is what you need to do. And a lot of times they're going in, they're doing things that aren't effective. So for example, in Nigeria, one of these interventions is like people in the past have gone to these communities and just built wells that they didn't maintain, they didn't help, and they thought we were helping people get clean water because we're building wells. Well, then the wells actually ended up being sources of infection and cholera for people in the future because the thing is they weren't properly maintained, they weren't ready for the local context, and so that is an example of not bringing your own assumptions or coming to learn and asking people
Mhm.
like, what do you need? How can we help? Because
Mhm.
you're not the expert of their own experience;
Right.
they're the expert, and that's something that's a core focus of global health and something that I really like about the Clinton Health Access Initiative, or CHI for short, CHI's model, because again, it's a very decentralized. So each country that they operate in has its own office. I was the only non-native Nigerian working in my office. The rest of them are born and raised there. They're working with the government and almost serving as consultants, asking, what do you need help with? And they're working together with them to co-develop solutions, which is great.
Mhm.
Second thing I learned is that global health is local. I think a lot of times people see global health as a separate field. I don't really think that's the case. I think that health system strengthening, as a topic and comparative health systems as a topic. But as far as global health goes, I think a lot of those skills are very local. I think you could be working on similar projects in Alabama that you would be working on in Nigeria, for example. And so one thing I was working on was building dashboards to evaluate the success of different quality assurance and training programs for clinicians and administrators in Nigeria. But those skills are highly transferable. I mean, not there are hospitals in America where people aren't even getting the basic standards of care. And the same, I can always say the same thing about Mexico, the same thing about Brazil, and the same thing about Scotland. I don't know. So it's like, I think a lot of times it's acknowledging that you do have value to contribute and that there are a lot of health challenges that are just global in general and thinking about, you know, if you're interested in global health, there are also opportunities to make similar impacts in your own backyard, thinking about what you can learn from and contribute to these environments that you're going into with your skill set.
That's super interesting. Thank you for letting us know and what you shared about the initial help that Nigeria was receiving and ultimately turned out to be not helpful at all. So, that is a really interesting thing for a lot of us to keep in mind when engaging in global health advocacy and even trying to go and help because we are not native from the area and we do need to be asking them how we can help them efficiently and adequately. Moving on and bridging to our last question. In your view, what role does health literacy play in achieving both educational and health equity?
Yeah, I think honestly, I think health literacy is one of the more misleading interventions. I will say, I think health literacy is very important because I like to use chronic conditions as an example. I'll go back to diabetes again. Preventable complications with diabetes contribute to 64% of lifetime costs for patients.
Wow.
And they contribute to a lot of bad complications. Diabetics aren't able to follow their standard management plans. They will have chronic kidney disease. They can have heart issues. They can have a blood sugar that's too high. They can suffer from blindness. They can lose their feet even and amputations. And that's from not being able to follow the lifestyle modifications and the plans that have been given to them. And so it's very important that patients are able to understand their conditions because it lets you advocate for yourself, to take care of yourself better. But one thing I'll note is that a lot of times I think people can overemphasize health literacy again because and I think that's one of the biggest fall into as a provider. Because if
Mhm.
your patients aren't getting healthier, you'll think, oh, it's just because they don't understand their condition or they don't know what they're doing. I think that can endorse some very paternalistic and problematic views of
Mhm.
medicine traditionally. So I think it's always important to see, yes, health literacy is a barrier. Are there
Mhm.
things even larger than health literacy that might be limiting my patients? So, for example, let's say a patient is diabetic and they're unhoused. Maybe the unhoused patient doesn't understand their diabetes, but could it be the fact that they don't have anywhere safe to store their medicine, or any water to take with their medicine? That could
Mhm.
be the reason that they're not able to adhere to their treatment plans. Or
Mhm.
maybe, somebody's just low income and they can't afford the foods that they're supposed to eat to manage their diabetes. And so it's again, like health literacy definitely is a big issue, but also thinking broader than that in terms of what other structural issues might be contributing to the worsenings of patients' diseases. But yeah, I mean, health literacy, if you're able to understand your health better, you're able to participate more fully in school and do better. Sicker people are probably going to have more trouble with school. I've had classmates who have struggled with different diseases and they've had to just miss weeks in and weeks out and have no idea how to balance all of that with school. It's very difficult. And on the flip side, we need a well-educated population in order that's going to be able to talk about some of these conditions with their providers. So it's all connected in a systems level way. But I'd always just encourage people to not overemphasize health literacy's role in somebody's health.
That's an awesome take. Thank you for sharing. And it's so evident that empowering the next generation is central to your work as well. So, what do you believe are the most significant misconceptions adults have about youth capabilities in health advocacy?
Yeah, I think it's that youth's voice are only valuable on a very minor set of issues. When people think about getting youth perspectives and advocacy, their minds immediately go to things like suicide
Mhm.
or vaping or something. I think those are definitely issues where youth voice should be elevated. But actually, a mentor of mine was just sharing earlier today, and we were kind of collaboratively brainstorming on this. How do we elevate youth voices beyond such a narrow set of topics? I think youth would be valuable in all sorts of conversations. And I think a lot of times organizations, for example, they'll have boards, they're lobbying organizations, and they'll have like a youth specific council. But how do we integrate youth into those broader governance structures that already exist? Their
Right.
input is collected at every set of the stage and not just these very narrow sets of topics. I think another misconception is just that youth are uninformed because, you don't have three fancy degrees behind your name like the other person. But I think that it's really important not to count out lived experience as a form of expertise and authority. When you've lived through something, nobody understands that experience, that particular experience, better than you do. And I think that's very important to recognize. And so I would definitely encourage adults just to recognize and appreciate the value and unique insights of every single young person around them. Because I think that one of the things that excites me the most about young people and gives me a lot of hope is that we're full of optimism because we don't really have any other choices, right? We see the world we're living in and there are things we want to change. Personally, I'm like, I don't want to live 65 more years dealing with that issue. I have to believe that it's something that can be changed and be fixed. I think a lot of youth bear that in mind because we will have to live with the consequences of the failures of the people before us.
Right.
And so I think that really gives us a lot of hope and inspiration to be active and leading movements to change those societal issues.
Awesome. So, aside from youth empowerment, we see that you do also contribute to youth success. So, how has your platform, meritscholarships.org, impacted students seeking higher education opportunities?
Yeah, so when I was applying to colleges, I had trouble finding merit scholarships to apply for, just
Mhm,
because I mean, my school had 2,800 students and just one college counselor, which is a horrific ratio. I just didn't know what was out there, and I knew I wanted to probably leave Alabama to go to college to explore a new setting, but I didn't know how I was going to afford it. It just took
mhm.
way too long to figure out what to apply for, and I definitely missed out on some opportunities because I didn't even know they existed. And so after that experience, I came to college, and I realized that I had the means and opportunity to maybe try and help fix that issue. So I created a website, scholarships.org, and help students find this centralized nest of different merit scholarships. So there's over 150 on there. Shared it with shared it with teachers so that they can pass it on to their kids. I shared it with friends, with their parents, and shared it on social media. And I just overwhelmingly received feedback like, wow, this is so great. This is exactly what I need right now. And it makes me really happy to know that I'm helping to make a difference in individual people's lives so that they don't have to struggle the same way I did.
So, it's great that you were able to utilize your experience and create a better experience for the incoming youth. What advice would you offer to young individuals aiming to make a difference in their communities?
Yeah, I would say reach out to people
Hmm.
would be my advice in the sense where I think when I was in high school, I really struggled to get involved in a lot of things I cared about just because there weren't opportunities readily available for them. But in college, one thing I've done a much better job of is just sending an email. I think you all have value to contribute and value to offer. You shouldn't count yourself out just because you're young. And the worst thing somebody can say is no. But it's sending that email, hey, can I set up 30 minutes to learn from you? And, being on time, being respectful and everything. But really taking the opportunity to learn from people or hi, I have these experiences. Is there any way I could collaborate with you guys or support your work and stuff like that? And just getting your foot in the door and getting some hands-on experience with some of the world's problems, it prepares you early and well to really be a leader in your generation when it comes to tackling a lot of these issues around us in our communities.
That's great. Thank you. And before we close, I'd like to ask a few short questions that offer a more personal look into your personal perspective. What's one belief that you've recently reevaluated regarding health equity, public health, disparities in health?
Yeah, I think one belief I've reevaluated probably came about 2 weeks ago. I read a book called Abundance by Ezra Klein and Derek Thompson. It's kind of a political book, but it was basically proposing a new way of thinking about a lot of the societal issues we have today. And so
Mhm.
specifically, like in terms of climate change, it makes the argument that we have too much bureaucracy in terms of climate change, and that a lot of these policies that were originally made to help slow down harmful things in the environment are now slowing down good things, like the building of solar plants and EV charging stations. So, in terms of the specific belief I'm reevaluating, it's the fact that more process is always better. I don't think that assumption is true. And it's something I tend to lean on. And it's like, hey, we should add this step and this step and this step and this step to make sure that we're doing everything the right way. But I think there is value in efficiency sometimes, especially with some of these really big issues. Look inward a bit more and think about where are there opportunities for efficiency in the work that we're doing, especially when we don't have many years to solve a crisis. How can we
Mhm.
be faster, yet still as equally effective in this work?
That's a really interesting take. Thank you for sharing. Who is a youth leader that you currently admire?
Yeah, so last week or no, 2 weeks ago, I was in Liberty, Missouri for the
Okay.
Truman Scholar Leaders Week, and that was such an amazing experience because I got to meet 53 other young people around the country who are doing awesome things, and they all inspired me. But I guess one person that I would shout out in particular right now would be my friend Sophie. Sophie is from West Virginia. She's finished her junior year at West Virginia University, and she is leading a lot of awesome work to help incarcerated people transition back to society after they get out
Wow.
prison. And so specifically, a lot of states have these transition guides because let's say you've been in prison for the last 40 months, or not 40,
Mhm.
40 years. You don't know how to use a computer. The world's just changed so much. And so, you need to apply for your license. Just do so many things to really be reintegrated properly into society. And West Virginia, as a state, their transition guide is just 3 pages. It has no guidance. It's really a checklist. It's like apply for a passport, get a computer. It doesn't say how to do that. It doesn't explain how to do that. So my friend Sophie who I was just chatting with earlier today in our big WhatsApp group chat, is doing a lot of awesome work to build a transition guide that's ideally going to be around 100 to 250 pages that actually goes into detail about how to transition back into society as a formerly incarcerated person. So that really inspired me because, again, it's people who are taking charge, looking at their communities about issues that really move them and doing something about it rather than just sitting on the sidelines and complaining.
That's incredible. It's so inspiring. And hopefully, we can speak to Sophie on our podcast as well in the near future. That would be amazing to
Yeah.
explain more about her work. What gives you hope in the realm of public health?
I'd say what gives me hope in the realm of public health is just the fact that people are starting to care again. I think public health, the issue with it is public health works best when people aren't seeing its impact or its need because it's a lot of prevention, you know. The reason that you're able to drink safe water is because public health has made sure that the water is clean. If it was dirty all of a sudden, then there'd be a lot of attention, right? But we don't, then public health would come in and save the day. But really, it's already saving the day without the need for that big crisis. I mean, we saw during the pandemic, that was when things got really bad. And of course, public health got really uplifted at the time. But
Mhm.
again, I think public health is typically doing its best, is shining most when you see it the least. But you know, right now in public health, there's just a lot of controversy. There's a lot of policy changes, and there are a lot of different public health issues around the country. But I think more stakeholders are getting involved. I think you're seeing more physicians join the front lines and getting involved. One thing that I'm involved with is called a healthier democracy, which
Mhm.
really helps physicians get involved in some of this political work. And I think that that's been a super awesome trend. I think you're seeing more general parents, more students starting that, you know, maybe they don't want to work in public health or that's not their field, but they're recognizing that public health affects everybody. They're asking, you know, what can I do? What can I do? You're seeing people rallying against these Medicaid cuts, people on both sides of the aisle who maybe never thought about Medicaid before are now saying, like,
Right.
they're waking up and realizing how much it does for the country. And they're, you know, you might not want to do politics, but politics is going to do you. And I think a lot of people are seeing that right now and stepping up
Right.
the sidelines and getting involved, which does give me hope because I think, you know, the more voices we get in this fight, the better informed action will be, and the more we'll be able to stand up for people's rights.
100%. That's a super important topic to realize. And then before we wrap up, is there a final message you would like to share with the next generation of public health leaders and any way that they can learn more about you?
Yeah, I think the final message, I'll give you a start. The final message I would share is just keep going. And you got to be your own biggest cheerleader. Times are tough, times are dark, but you all have a light inside of you. And, you know, you as an individual have the potential to make so much change.
Mhm.
First thing you have to do is just get going, to surround yourself with people who support you and lift you up and take care of you, take care of yourself, and then get after it. In terms of people who want to follow my work, most of my professional updates are on LinkedIn, which is my first and last name. So if you want to follow the work I'm doing and where that takes me, you can find me on LinkedIn.
Awesome. And thank you so much, Rod, for sharing your insights and illustrating the profound impact of youth driven health initiatives in education and in health. We hope today's conversation sparked reflection and affirmed that youth voices are essential to building a more just, responsive, and innovative health system. If you're ready to take the next step, visit projectunitynfp.org to connect with other changemakers, explore student led initiatives, or get involved with future episodes. I'm Hargan Sachar. On behalf of Project Unity, thank you for listening. See you next time on On Call.